In April 2025, AFROCAB partnered with the Fight AIDS Coalition and the Global Network of People Living with HIV to host a regional meeting on advanced HIV disease advocacy. This event gathered representatives from various organizations to discuss the impact of changes in the global HIV funding landscape and to foster collaborative problem solving. The meeting aimed to strengthen partnerships to effectively reduce advanced HIV disease incidence and mortality. Flavia Kyomukama, Executive Director of the National Forum of People Living with HIV/AIDS Networks in Uganda, shared her insights in the video.
Lately, we've realized that we are losing people, not because they are on treatment or in care, but because there are other diseases, opportunistic infections, which are coming that were never anticipated.
Okay.
With the advent of ART, we thought was the magic bullet, but it isn't. So right now we realize that people on ART who are lost to follow up come back into care or are in care, and we realize that we have emphasized viral load and we forgot to look at CD4 count.
Okay.
And so CD4 count has been left for a few cases where they think they want to check the immunity status, but we believe that now we need to reinitiate CD4 count testing, because we cannot only rely on viral load. One could have low viral load, but also have very low CD4 count. We need to be able to detect early those other diseases that can take advantage of low immunity. Because viral load now might be good, but doesn't last for 6 months.
Right.
And yet we are going to pick medications after 6 months or after 3 months. And in these 3 months, something can happen. We need to have seasons or times when we also check CD4. And we know that when we go private to do it personally, it's quite expensive. But we could engage with government because they are buying in bulk. It can be reinstated and then we initiate that process for people who have been long on treatment and those who have been lost to follow up. We need to up medication for opportunistic infections because we know they are the ones which even advances people to higher viral loads and eventually death. But first of all, we need to ensure that our maternal antenatal clinics are working and that mothers who are HIV positive are detected early in their pregnancy and then kept in care for that length of time, provided the services that require to be provided. But then we have the adolescent girls and young women who normally get lost around this time. We need to have a follow-up mechanism that is embedded in the system. The facility is able to know this person came, they didn't come, who can follow. So that's why we need our community health experts. Peers, the people, the women, adolescent girls and young women or mentor mothers, mentor fathers, who know and who can actually follow up and support these adolescent girls and young women who are pregnant to be retained in care. And so the other challenge we are having is that there's a lot of death at birth. 1 day to 1 year old. And some of these die without having clear diagnosis. So we need to ensure that there is a way to follow mothers who are HIV positive and ensure that they bring their children for testing as prescribed. But also ensure that they are giving the Septrin and the Regulatine as prescribed.